Good evening. Today is June 19th, and today I'll continue to be talking about the coronavirus. So the first piece of news that I'd like to talk about is that Italian scientists today said that they have found traces of the virus in samples of sewage water collected in December, further suggesting that the virus was already circulating in the country months before the outbreak at the end of February. Researchers at the Italian National Institute of Health discovered the presence of the RNA of the virus in samples taken in the northern cities of Milan and Turin on December 18th, more than 2 months before the country's first case was diagnosed on February 20th. There were also traces found in samples from the city of Bologna, about 125 miles south of Milan, on January 29th. So I think this just shows that the virus was already circulating, probably in asymptomatic or little symptomatic forms before the first local case in Italy, and this just adds to the growing evidence that Italian scientists and officials have long suspected, which is that the virus had moved undetected in the northern region of Lombardy. Similar evidence has recently emerged around the world, indicating that by the time the authorities were aware of the outbreak, the virus was already more spread than initially believed. And furthermore, I think this just leads to the importance of precautions that must be taken by the general public, especially now that since we know the virus is circulating. Some other coronavirus news from the world includes Brazil surpassing 1 million coronavirus cases today, recording a staggering 54,771 cases in the past 24 hours alone. Latin America has now become an epicenter of the coronavirus pandemic in recent weeks, largely driven by Brazil's ballooning caseload. The Prime Minister of Shinzo Abe of Japan lifted a virus-related ban on domestic travel, and his government is also in discussions to ease international travel bans for passengers arriving from Australia, New Zealand, Thailand, and Vietnam. So overall, in those areas you can see mass reopening, and in Spain updated its death toll from the virus for the first time in almost 2 weeks, and the country's health minister said 28,313 people have died, which is up from the last data on June 7th. Overall, I think we need to understand that the coronavirus outbreak is not gone right now, and we need to take precautions. The second thing that I'd like to talk about is that health experts worry that in the race to find drugs and vaccines, a substantial portion of studies may be excluding older subjects, even as 80% of American deaths have occurred in people over age 65. So I think Dr. Sharon Inouye from Harvard Medical School and her team have reviewed 241 interventional COVID-19 studies that have been undertaken in the United States and are listed on clinicaltrials.gov, and they found that 37 of these trials, which test drugs, vaccines, and devices, set specific age limits and will not enroll patients older than 75, 80, or 85. I think there's just a long history of older people being excluded from clinical trials, even when the disease in question disproportionately affect the group. And I think ideally, the patients enrolled in randomized clinical trials reflect the demographics of the disease. Unfortunately, this is seldom the case, and I think this is going to be a problem if, let's say, a vaccine comes out and it works in the younger population but leads to lethal side effects in the older population, then this vaccine is almost useless because COVID-19 specifically targets the older population. And I think clinical trials for treatments or vaccines should enroll more volunteers that are older age, especially if they want to get a more accurate result from the testing. That's it. Thank you for listening, and have a good day. Thank you.